we got more than 4,300 people who signed this petition. A common reaction from people was that, of course, we don't want pesticides in baby food. I'm surprised that they're there anyway. So that was a very common reaction that we found when we asked people if they're interested in signing the petition. So in my written submission, I carefully gave references to support the fact that different countries around the world, different regulatory authorities have made a special provision for children in regard to pesticide residues in food, and baby food in particular. The European Union, which is the model that has led the way on this, has certain directives, which are detailed in the submission, with a basic policy of a zero tolerance for pesticide residues in baby food. And this is what we want to encourage this select committee to think about doing for New Zealand, so that we can do this and better protect Kiwi babies. We believe that Kiwi babies deserve the same protection as European babies, for example. The other thing that I'd like to draw your attention to is the rather startling information that if we compare the European Union surveys of baby food, we find over 2,000 samples of baby food. We find that 0.04% had pesticide residues. We can contrast this to New Zealand. In the last Total Diet survey that was published in 2009, 31.7% had pesticide residues. And this is an enormous difference, nearly 800 times more pesticide residues in New Zealand baby food. So we would like something done about this. One of the things we'd like to be done, apart from New Zealand following the European Union directives, and that makes it easy because it's already been done, is to do more regular and more extensive surveys of baby food. At the moment, we have baby food surveys that are part of the Total Diet survey in New Zealand about every 5 or 6 years, and the last one was done in 2009, and that's not nearly enough. They have 8 samples. In the last one, they had 8 samples of 4 different categories of infant food, processed infant food in New Zealand. And we argue that that's not nearly enough. We need to establish a baseline to act from and to compare it internationally. And 8 samples of 4 different types of food is not enough. So at this point, I'd like to hand over to my colleague, Dr. Meriel Watts.
Thank you. I'm the author of the book that's just been handed out to you, and I hope you can find some time to read a little bit of it. And so I'm here on behalf of Pesticide Action Network, and I really want to talk about why it is so important that children are protected and why they're so much more vulnerable to pesticides than we are ourselves. We need to understand also that the MRLs that are set for the maximum residue levels that are set for our foods are based on adult tolerances, not on children's. So they do not automatically protect children. And in many ways they don't protect them at all. Children eat and drink much more relative to their body weight than adults do. In terms of water, it's about 7 times more. So this is because their intake relative to their body weight is much greater than an adult's. Therefore, their intake of pesticides is much greater than in adults relative to their body weight. We don't have exact figure for food, but we know that for drinking water it's 7 times more. So it would be a similar level of increase for food. And this at a time when they are particularly vulnerable to those. They also breathe in a lot more air than adults. Now I mention this not because we're talking about air today, but because when MRLs are set, they're set only on the basis of the amount of one pesticide in that food. They do not look at the other avenues of exposure. And children are exposed by breathing more air. They play on the ground. They pick up residues. They have hand-to-mouth behaviour. Those ways also result in much greater exposure of children to pesticide residues than we do. They're also born what we call pre-polluted. Mothers who are exposed to pesticides, they pass across the placenta. They're found commonly in amniotic fluid, in the placental cord blood, in the fetus itself, and in the fetus's firstborn feces, the meconium. Something like, I think, 46 different pesticides are now measured in the firstborn feces of children. That means that these children are already carrying a load of pesticides before they even hit the world. This is also not taken into account when MRLs for food are set. And what we have is a situation where a lot of these pesticides are additive or have synergistic effects. So if you add one more pesticide, the total effect increases. This is not looked at when the MRLs are set either. Only one pesticide at a time is looked at. So in this respect, we're totally underestimating the amount of exposure children have. But what's really critical is the vulnerability of small children, the developing fetus and then the newborn children. All of their body systems are still in the process of developing at this stage, particularly the brain and the immune system. And during that development process, they're acutely, exquisitely sensitive to interference by minute levels of pesticides. This process of development is also not taken into account when MRLs are set for food. So if a child is exposed to an endocrine disrupting chemical, in that point, it can affect their development for the rest of their lives and also down to subsequent generations. I won't go into that too much now because it gets a bit complicated scientifically. There's in the book about that. I want to draw your attention to one pesticide called pyrophos, and it's just an example, and it's an example that we use because we have a lot of information about it. Already we know that New Zealand children are exposed to something like 100 times more residues of chlorpyrifos in their food than, for example, Japanese are. This is based on Australian work. We don't have a similar work for New Zealand, but it's a high level compared with overseas. We know that chlorpyrifos is found in a number of our foods. We know that, for example, we also know from studies in the US that very, very, very low levels, for example, 4.6 picogram. Now, picogram is a tiny amount of food, far below what we measure in our residue monitoring. 4.6 picogram of chlorpyrifos in the cord blood going through to the developing child is enough to lower the IQ and the working memory of that child to a significant level. 4.6 picograms is about 400 million times less than the levels of chlorpyrifos that have been found in some of our food supply. So, of course, not all of that is going to be absorbed by the child and end up in their brain, but a substantial amount of it is, because chlorpyrifos is very readily and widely absorbed by humans. So I use this just as an illustration. Many other pesticides are also found at higher levels in our food and can impact children's brains and other developing organ systems. So in conclusion, I just want to say that in my book and in my submission, I have stated internationally accepted evidence-based reasons for why children are very much more vulnerable to pesticides and why they're so much more exposed than we are. I've illustrated this with just one pesticide called pyrifos, but children are exposed to a huge number of chemicals, including pesticides, on a daily basis, all of which can interact with each other and contribute to undermine their ability to contribute to society productively. Any decrease of IQ in a small number in children shifts the whole spectrum of intelligence to society towards the lower end. It means that we end up with a huge increase in the number of people who are, we could say, intellectually challenged, and a huge decrease in the number of people who are gifted. This automatically has a major impact on our society and our ability to get ahead in the world as a country. It also has a big impact on our social systems, because one of the things that goes hand in hand with this is an increase in crime statistics, an increase in suicides, and an increase in a whole number of difficulties in socialising, as well as, of course, increases in health problems, other health problems, all of which have a huge impact on the costs to our society in terms, including the health system. So it seems to me it's entirely reasonable to ask that we have zero residues of pesticides in baby food. I noted in the paper this morning a letter from a gentleman from Wairarapa pointing out that the government is spending quite a lot of money to subsidise the production of apples with zero residues for the Japanese market. Why can't we do something to regulate for zero residues in babies' food? Surely we care about the residues in our babies' food, we would hope, more than we do about the Japanese market. Thank you.